Look around you. Chances are you're watching this video indoors. If that's the case, what do you observe?
Can people with disabilities easily use the space?
How's the indoor air quality?
Are the materials around you safe?
Observe the lighting. Does it enhance the space without causing glare?
How are the ergonomics?
Was the interior space designed in compliance with local building code?
These are just a few of the many components that an interior designer studies in any given project. Interior designers need to possess the knowledge and skills to create interior environments that are safe, healthy, and functional.
When I think of interior designers, I think of when people are trying to redo their kitchen or their basement or somebody, they have somebody come in and then they look at the place and suggest ideas and stuff about what they could do to make it the best.
They help people like furnish their homes and design them and whatever they're putting in them.
I think interior designers do furniture inside.
I think they do upholstery, like fabrics for furniture and blinds, and
They kind of put together rooms.
How can we better educate people? How can we clear up the blurred line between decorating and the profession of interior design? We need to be unified in advocating for our profession. But why?
It's important to make the interior design scope of services clear and defined because it's important to know how to talk about what we do. It's important to know how legal recognition impacts our profession. It's important to understand what is happening in our state and others and how legal issues affect the profession. Currently in Colorado, we have a permitting statute that was enacted in 2001. We have a local group here called the CIDC, the Colorado Interior Design Coalition. It's a not-for-profit volunteer group that acts as the interior design profession's leading advocate for legislative concerns in the state of Colorado. Its goal is to establish standards and legal recognition for the practice of interior design as it relates to health, safety, and welfare of the public. CIDC's mission is to act as a single voice to represent, protect, and promote the interior design profession in legislative and regulatory matters. The interior design profession in the state of Colorado needs to be legally recognized as an essential component in the design of the built environment.
Medical errors are the 8th leading cause of deaths in America, killing an estimated 98,000 individuals each year. A study published in 2008 by the Institute of Medicine revealed that in a 2-year period, 1.1 million patient safety errors occurred, resulting in nearly 240,000 potential preventable deaths. The associated cost to hospitals was approximately $8.8 billion. The relationship between the built environment, patients, and staff is proven to be a key factor in the amount of medical errors, hospital-acquired infections, and the result of patient outcomes. As educated or licensed interior designers, we use empirical research and evidence to make informed decisions when it comes to these spaces. It's so important to have qualified interior designers working in healthcare environments in order to reduce hospital-acquired illnesses and increase patient safety. This ultimately results in better financial outcomes and patient satisfaction.
Lighting is a crucial part of a well-designed space. Poor lighting can make a great space look average, and great lighting can make an average space look magical. But lighting has to do so much more than beautify a space. It has to meet strict energy codes, and they get more stringent every year. It has to provide adequate illumination for visual tasks, like reading or working. It must illuminate emergency exit paths, and it must be designed to minimize glare. Add to that emerging research that lighting sets our body clocks, affecting sleep cycles, immune function, hunger, and even sex drive. And it becomes clear that lighting is complex and vastly important. So what does all of this have to do with interior design? While licensed interior designers are not required to have the specialized knowledge of a lighting designer, they are required to have core competencies in lighting so that they can understand and coordinate lighting design with interiors, architecture, and engineering, making spaces magical.
The Americans with Disabilities Act, ADA, gives civil rights protections to individuals with disabilities similar to those provided to individuals on the basis of race, color, sex, national origin, age, and religion. Understanding code requirements and ADA compliance is essential for professional interior designers. Without regulating the profession, there is risk of creating non-compliant, unsafe environments.
As an interior designer, you're really a client advocate to protect their health and safety and welfare. And I think when people get into this profession, sometimes there's this misperception that it's all about aesthetics and selecting the finishes, when in reality, the good portion of your job and your responsibility is to study the code, to understand lighting issues, and making sure that it's a safe and inspiring environment for the occupants.
Multidisciplinary commercial firms make up a large part of the market. It is common in these types of firms that work be assigned mostly based on interest and ability, rather than academic background or professional credentials. It is impossible to separate the design of a building from the design of its interior. The building is directly impacted by the programmatic and code constraints of the interior, while the interior evolves from the building design.
As a recent graduate with a Bachelor of Science in Interior Design from Colorado State University, a state-funded school, I can't understand why the state does not recognize or protect our rights to practice our abilities to their fullest extent. Although Colorado does not recognize legislation in the same way, it is important to understand what legislation exists when working across state lines.
Indoor air quality is something interior designers study and design for. Interior designers coordinate with mechanical engineers to design properly ventilated buildings. The materials that we specify must meet certain criteria to keep people safe from airborne illnesses caused by formaldehyde, VOCs, radon, and other contaminants. According to the U.S. Environmental Protection Agency, the medical and lost productivity costs of workers breathing poor air amounts to tens of billions of dollars each year in the United States alone. Improving energy efficiency leads to better working conditions, resulting in significantly increased worker productivity. OSHA estimates the total annual cost of poor indoor air quality to U.S. employers at $15 billion due to worker inefficiency and sick leave.
Interior designers should be qualified to practice based on education and experience. The Council for Interior Design Accreditation, or CIDA, creates programs for state and private universities across the nation. These programs assure the public that interior design education prepares students to be responsible, well-informed, skilled professionals who have the capability to construct safe and healthy interiors. These designs focus on sustainability and wellness as well. The NCIDQ certification establishes global standards or competence for health, safety, and welfare in the interior design profession. This is 16 hours of examination that is vital to standardizing and regulating our profession. The cost is about $1,500 with study materials, and the average study time is approximately 6 months. This is a huge investment. This test should result in licensure for interior designers in Colorado as it does in 27 other states.
Sasha Wagner wrote, "Licensed interior designers practice in code-based environments like commercial offices, education, or healthcare facilities, and their work protects the health, safety, and welfare of the occupants. This includes protection from fire and smoke inhalation, toxic materials, bad air quality, stress, injury due to poor ergonomics, and eye strain from inadequate lighting, just to name a few health and safety issues. Regulating this profession is fundamental. Claiming it's all about aesthetics and style is simply naive. Our job is to make spaces that improve the quality of life for the people that inhabit them by designing safe and functional environments. We enhance the human experience through analysis of problems and client needs. We identify problems and then solve them through research and creativity.